central tendon down. We're going to talk about this all as an overview in just a second, so just make sure you have this highlighted. The central tendon is the connective tissue that is surrounding the lungs. So when we make an inhale, our umbrella is actually collapsing or pulling down. So if we had the thought of a syringe, when I pull back on that plunger, we're creating that suction. So that's what's happening in our diaphragm. It's pulling down on the lungs so that we're sucking that air in. The opposite happens in exhalation. The muscle fibers of the diaphragm relax or they blow back up. Our umbrella goes back up. So inhale, it comes down, creates that suction. Exhale, it pushes back up so that we're pushing all of that air back out on our exhale. When we look at the bottom, so this is where I have inhale, it collapses, exhale, it releases. But all of these areas I want to make sure that you have highlighted. The central tendon is what's at the very top. It actually helps to work with our lungs and our heart, and we're going to look at that separately in just a second. I want you to notice here is quadratus laborum, and here's our lumbar vertebrae, right? So our diaphragm has an effect on our lumbar vertebrae as well as our deepest abdominal muscle, quadratus laborum. The abdominal aorta, which we talked about a little bit ago, goes through the very center of our diaphragm. Then I have the esophageal hiatus. So right here in the very center is an opening in the muscle. So if you've ever had a hiccup, or sometimes you can feel something that you're swallowing go all the way down and through your diaphragm, that's why, because there's an opening in the muscle for our esophagus. And then this vena cava foramen is a hole that is going up to our heart. Here we have what causes the hiccup, which has to do with what's going on in our diaphragm. When we think of the action, inhale, it collapses, exhale, release, that's where the thought of the central tendon will be something that we want to be aware of. So on the bottom of page 214, although I don't like that they necessarily refer it to yogis, but it is still appropriate for us to think about. The heart is affected by the motion of the diaphragm because of the central tendon. So we have on the inside of our rib cage, we have our diaphragm in here, right? Goes up in here. My heart is under here. So when my diaphragm inhales and exhales, it's making my heart float up and down because of that central tendon. So our diaphragm and our heart, the outside of the heart, are attached by that central tendon. We've all taken that one deep breath and like, whew, I feel a little better, right? That has to do with that connective tissue tendon. So I want to make sure that you remember what the diaphragm does on an inhale and an exhale. Little easier to read it here instead of just the actions here, but here's other words for it. So that is what's on the inside of the rib cage. The next two muscles on page 215 are like the meat between the ribs. So it's between the ribs. We have internal and external muscles. So small, slender muscles holding our rib cage together. And you can feel those on yourself. You can definitely feel the difference between the muscle and the bone. We have external are the ones that we are going to be able to feel. The internal, obviously, we're not going to be able to feel on ourselves or on a client. But the fibers of these two groups run perpendicular. So in your book, it'll be a little easier to see how the fibers lay. They are not laying in the same direction. So they're more oblique and opposite of each other. The intercostals as two groups or two muscles, they're helping to stabilize our rib cage and help to expand and contract our lungs. In class, we'll do our three-dimensional breathing, which is being aware of how our rib cage moves anterior, lateral, and posterior and superior, all within that inhale, and then the opposite occurs with our exhale, so being aware of that. I want you to know this, absolutely, because the state could ask you this, for those of you that are going on for that. So when we take an inhale, then our ribs are, again, they're moving up. So our external intercostals are helping to expand our rib cage. They're increasing that space. The internal intercostals are doing our exhale or decreasing the space so that more of our exhale can be out. So again, that's that three-dimensional movement. As far as actions, you need to know that. Other than origin and insertion, you need to know external is the outside, internal is the inside. So not as difficult, but you absolutely need to know this information. During our hands-on time in class, we'll work with making sure that we can identify the difference between the external intercostals and our rib cage. Page 216 for our next two muscles, which are saw-like. Serratus means saw-like. And if you just look at how the names of these muscles, serratus posterior superior, I bet that means it's the saw-like muscle on the back that's higher. And then serratus posterior inferior, going to be saw-like muscle that's on the back that's a little lower, right? It tells you where they're located in their names. When you look at the breakdown of origin and insertion, it's going from the spine or the center out to the ribs. So they're sandwiched between the shoulder blades on the superior, and at the bottom they're going to be between that thoracolumbar fascia down at the very bottom, at the bottom of our rib cage. The belly of superior is partially deep to the scapula and has fibers that run parallel to the superficial rhomboids. So to go all the way back to chapter 2, if you can get to that medial border of the scapula, then you're absolutely going to be at serratus posterior superior. Why bony landmarks matter never changes. The inferior, so down here at the bottom, again, it is deep to the thoracolumbar fascia, and during exhalation, this is what is stabilizing the ribs against the pull of the diaphragm. Low back pain, which is why it will be important for us to do a diaphragm release, as well as focus in on those external intercostals. The other two pictures on 216 are just showing how you might be able to palpate, but again, if you're finding the medial border, you'll be a little better with that. Here's the inferior, so down towards the bottom, underneath that thoracolumbar fascia. I think, yes, the last two muscles, which I know you're super excited about. Page 217, we have two separate groups, which, as far as trying to memorize things, you don't have to memorize much because their names tell you. So we have intertransversary, small, short muscles that are spanning between the transverse process, because we have the intertransversary versus the interspinalis. I bet those are going from the spinous process. So small, short muscles that are going from transverse process to transverse process in our cervical and lumbar area. Interspinalis are small, short muscles that are spanning from spinous process to spinous process, also in the cervical and lumbar area. It is pretty safe to say that you probably will never be able to actually palpate these muscles because they're very deep, or you won't be able to discern them, but if you do your due diligence and go from transverse process to lamina to spinous, and you're actually feeling those bony landmarks, you will be affecting them, but you might not just be able to tell them separately. So you can affect them for sure. So intertransversary are the deepest muscles in cervical and lumbar region. Our interspinalis are deep to the interspinous ligament. That's that connective tissue that's covering on our spinous process after ligamentum nuchae. All right, so you can just know where they're located by their name. That's the end of our muscles. As an overview of all of those muscles, let's look at the pictures. We'll start on page 188. So on page 188, here's our groupings. Our erector spinae, transversio spinalis, splenius capitis, splenius cervicus, and the suboccipitals. So that's what we're showing, a little darker color in these pictures. You definitely want to know these for your chapter test. The next page, the same. They're showing you the same, but they've just cut away some more of the muscles so you can focus in. On the next page, the same thing is occurring, but it's just that lateral view. So page 190, just what it looks like when we have a side view. The majority of those muscles you have had, we haven't talked about sternocleidomastoid yet, but that's coming up in the next chapter. And this is down into our pelvis, that's chapter 6. And again, just showing deeper where all these muscles are located. The workbook will help you go through this information. And the last one that will be important for you to visualize is 191. I do want you to know these two pictures, which is basically identifying those multifidi, the rotators, splenius capitis, splenius cervicus, semispinalis capitis, all of those. Just knowing where they're at. Before we get into actions, I want you to just take this in for later on or now. So this is page 192. This bottom picture, we're identifying the transverse process in where we've cut someone's head and neck off. Trapezius is a muscle we've already had, so now we can see where that muscle is. The spinous process way up here, this area. Here's our ligamentum nuchae, that little dot right in the center there. So we know we have other muscles that are surrounding it. The nuchal line, so we have the external occipital protuberance, and then we go to the side, so this is going there. I want you to just look at how many of these muscles are affecting our neck in this area, which is something that most of us talk about tension in our neck, the back of our neck, our upper back area. And now look at how many muscles are being affected. As well as, can you identify what this yellowish layer is? I know, always going back to chapter 1. All right. The other pictures on page 193 are just different views of the same thing for your viewing pleasure, just as a thought process. Okay, so we are going to move into the actions, which again, we're going to talk through it. It'll make more sense rather than just looking at page 194 and going, oh my gosh, there's a lot going on. We'll start with flexion, and notice that I have 3. There is 3 from this chapter that I want you to focus in on, because this chapter does not cover psoas major and it does not cover iliacus. So we're not going to even focus on those 2 at this point, but I just want you to know that rectus abdominis, our 6-pack, and then the internal and external obliques are those 3. So when we do a sit-up, rectus abdominis, internal and external obliques, both sides bilaterally. But I want you to think about the antagonist that is happening, which is then our extension. And there's 6 that I want you to focus on for extension, which is our 2 groups, the erector spinae and the transversospinalis. So as long as you know what 3 muscles are in those, 3 to do the sit-up, which means these 6 antagonists are definitely fighting it, but it's easy when it's just the 2 groups, which again are all written here. Rotation is a little bit more challenging, but notice that I have that there's a total of 4 that rotate, 3 opposite, 1 same side. So whether you want to memorize the same side or the opposite side one, personally I think if you remember the 1 same side, then you would know the other 3 are the opposite side. So internal oblique is the one that is rotating and firing on the same side. So if you rotate your upper thoracic area to the right, it is your right internal oblique, but your left external oblique, left multifidi, and left rotators. So it's easier to break it down this way. Then we go to the top of page 195 for lateral flexion, which is just like a side bend. Does not involve the pelvis. We're only talking about the thoracic area. So there's 6, but we have our 3 erector spinae, quadratus laborum, internal oblique, external oblique. So does that make sense? If you are standing in a neutral posture, which we'll talk about that more in class time, and you do lateral flexion or that side bend, does it make sense that it's your 3 posture muscles that are making you go that way, as well as quadratus laborum, internal and external oblique? Now we come to an easy part. The bottom of 195, we have our inhale or elevation of our rib cage, exhale, which is our depression or collapsing of our rib cage. But notice only the external intercostals and serratus posterior superior are helping with that lift up of the rib cage. Internal intercostals and serratus posterior inferior are pulling it down. So yes, there's a lot of other muscles that are involved with our inhalation, but not from this chapter. So you need to know what lifts our rib cage up for an inhale and what bring it down for our exhale. That's what's important in this chapter. And that's it. So visually, again, I want you to make sure that when you focus in on the actions, that it is important to know which ones are specific for this chapter, and breaking them down only helps when you know exactly where the muscles are located. So the actions come from where the muscle is, and that is the most important part.